Today is World Kidney Day. And do you know that diabetes is the leading cause of kidney disease and kidney failure across the world? Why is that so? To understand that, we have to understand that when the kidney is functioning normally, it is doing so with the help of millions of small units which are known as glomeruli. And it is this glomeruli which is basically responsible for excreting the waste products out from the body while retaining the good ones. So what happens is that when diabetes has been there for a considerable period of time and has been uncontrolled, the high blood sugar levels, they trigger a number of processes like inflammation, like glycation of proteins, like oxidative stress, etc. And because of these harmful processes which are initiated, the glomerulus get affected. So what happens is that the membrane, which is responsible for filtering out the waste products, this membrane gets damaged. It becomes thickened, it becomes scarred, and eventually this becomes damaged. Also, there are tubules which are leading out from this membrane, from this filter or barrier, and these tubules are responsible for, number one, excreting the waste products and reabsorbing some of the good products back. Now, these tubules are also damaged when blood sugar levels remain uncontrolled for a period of time. The third thing that happens is that the vasculature, the blood vessels that lead on to these glomerulus, what happens is that the blood vessels that is supplying the blood to the glomerulus, that becomes widened. So there's an increased amount of blood flow, while the blood vessels that is leading out from the glomerulus, that becomes thickened. So that blood is not able to pass out, and there is an increased amount of pressure at the level of the glomerulus, leading on to glomerular hypertension and glomerular hyperfiltration. So this basically manifests as initially as a stage where excess amount of protein is being secreted from the kidney. So eventually the amount of kidney that is seen in the urine is like less. It's called microalbuminuria, which eventually leads on to a stage where there is macroalbuminuria. A lot of protein is excreted in the urine. And eventually, as this process continues, the glomeruli are damaged. They are completely unable to perform their function, leading on to a stage of end stage renal disease or kidney failure. So what can be done about it? So basically, since the pathophysiology is high blood sugar, what needs to be done is, of course, controlling the blood sugar from the very word go. You cannot be complacent about blood sugar control at any point in time, because remember that these changes, while they are occurring at the level of the basement membrane or the tubules or blood vessels, you are not being able to comprehend that. The patient is not able to understand anything that is happening inside, so has no symptoms whatsoever. It's only in the later stages of the kidney disease that the symptoms start coming in, right? So do not depend on symptoms. Like, don't think that my kidneys are doing well, I have no symptoms, there is no swelling of the feet. The patients often tell us, my urine output is all right, why should I test for my kidney disease? So remember that you have to keep your blood sugar levels under control. You have to keep your blood pressure under control. You have to maintain a certain form of diet. For example, if your kidney is affected, your doctor tells you that the kidney is affected, the dietary changes would be made in terms of the amount of protein that is to be given, the amount of salt that has to be given, the amount of water that has to be given, depending on the stage of the kidney disease. That is what your doctor will tell you, your dietitian will tell you, and you have to follow that. But firstly, you have to get your tests done to understand whether or not your kidneys are involved because of diabetes. So apart from your blood sugar levels, you also have to test certain parameters of kidney disease, like number one, you have to test the urine. You have to test the urine ACR, which is the albumin-creatinine ratio, and gives us an idea about the amount of protein being excreted from the kidney. So depending on that, your doctor will tell you whether it's in the normal range or is it high or is it very high, and also your kidney function test, particularly the serum creatinine. So these tests would have to be done at least annually, that is once a year. But if you have levels which are higher than normal, then your doctor will ask you to test it more frequently, say like in 4 months or 6 months, depending on your stage of the disease. So also remember that nowadays we have certain drugs which can help in slowing the progress of the kidney disease, and also at times reversing it. But to do that has to be first of all diagnosed at the right time, so that the medication can be started at the right time, not after the kidney has been completely damaged, because at that stage what is left is only, say, the option of dialysis or kidney transplant. So before it reaches that stage, when the creatinine levels are rising slightly or the urine protein is more than what it should be, there are some active changes to be made that can be made, that would be suggested by your doctor. But again, as I said, unless you check for it, you'll never know whether you are in that stage of the kidney disease. So today on World Kidney Day, let us resolve that we will keep our blood sugar levels under control, our blood pressure under control, we will maintain the dietary changes and regularly check for for any signs or any results which are showing that the kidney is getting affected. And if it is so, if your doctor tells you that such changes are there, you will make the necessary changes so as to prevent it from progressing forward.